Hello everyone. Dental practices, like all healthcare institutions, carry an infection risk, and I want to demonstrate to you how we ensure that that risk is minimized and perhaps albeit eliminated. So I'm going to take you to a part of the dental practice that you almost never see. It's our sterilization room, and I'm going to talk you through it, and Ghislaine will show us exactly how we keep you safe. So come on down. Okay, so I'm sure many of you have walked past this room and wondered what was in it. So this is the room in which we essentially keep you safe. And it's designed in a way that the instruments that we've used on each individual patient come into the room. And as you can see, the room here is labeled the dirty side. So everybody that comes into our practice knows that used instruments are here. And then there's one sink for manually cleaning the instruments if you want to. This is a dental dishwasher. It's an ultrasonic cleaner. This sink is for instruments that have been through the ultrasonic, through the dishwasher. They come in here to be rinsed, and then they go into our sterilizer. So we'll show you one step at a time how we clean the instruments. These are just some examples of instruments that have been used, but we want to show you exactly what we do for the dirty instruments. So because we are using the dental dishwasher and it has to be submerged, it stays in that dental dishwasher for 10 minutes. Some of you at home are used to cleaning your dishes perhaps before you put it in the dishwasher, and in a dental sense, that's what this thing is for. But to try and also keep ourselves safe, we put the instrument straight into the dishwasher. I keep calling it dishwasher because that's what you'll be familiar with, but it's an ultrasound bath. We're going to leave that in there and then show you what we do next. As you can see, the cycle is complete. Instruments are still submerged, and we're now going to take them out and rinse them under cold water. Now the instruments have been submerged and rinsed to get all the detergent off. She's now going to dry with this lint-free cloth to ensure that there's no lint left on them. There's this magnifying light that Ghislaine is going to use to inspect under magnification that the instruments are free of all types of debris. So that's exactly what she does for every single instrument. We know that those instruments are free of visible debris from previous patients. But how do we know that they're free from proteins? And why am I talking about proteins? You will all remember mad cow disease from all those years ago, and the fact that it could be transmitted from person to person by proteins. And what we now do is check that those invisible proteins have been adequately removed by immersion in the ultrasonic bath. Ghislaine is going to do our protein test with this little kit right now. So she's just going to take a random selection of instruments. She is inserting that swab into hard to reach and hard to clean areas, because those are the areas that could easily be missed by the ultrasound bath. And she's going to check in a second whether there are any proteins on that swab. And so the liquid that was in the top there has now been pushed down onto the swab. If the liquid is green, then it's fine. If we see anything other than green, the instruments are essentially reprocessed. And that way we know that not only are the instruments free of visible debris, they're also free of proteins. We like to ensure that everything is tested to make sure that you're always safe in our hands. The other way we ensure that the ultrasonic machine really does what it is supposed to do is to do what is called a foil ablation test. So we start with pieces of foil that look something like that, okay? They're just any kind of foil that you have at home. And what we're expecting is for the ultrasound, the ultrasonic waves inside the machine to actually damage the foil and destroy part of it. And you can see that we start with strips of foil that have straight edges, like that. And you can see there that the edges have been damaged. We're starting with these pieces of foil to show us what you do with this. Again, those pieces of foil are then put inside the machine, generally submerged, and then we start the cycle again. Now that the foil test cycle is complete, let's see whether it compares with the results that we showed you earlier. Go on, pull them out. Look at that. The machine is absolutely amazing. It's completely destroyed the sheets of foil that were put into the machine that you saw earlier on, and that shows that this machine is firing on multiple cylinders, and as a result is very good at cleaning even the most heavily soiled instruments. And that means that Ghislaine doesn't have to manually clean the instruments the way some of us would manually clean our plates before putting them in the dishwasher at home. The only other thing that needs to be removed from the instruments are bacteria. The main piece of equipment that we use to ensure that our instruments are sterile before we use them in use is our autoclave. And one of the things I want to show you is how we not only use the autoclave on a daily basis to ensure that the instruments are sterile, but we also validate that the autoclave is working according to manufacturer's specs by doing 2 tests specified legally. Those are the standards in the UK for keeping instruments clean. So let's turn our autoclave on, and it will take its time. I've never been able to work out what this auto test is, but the manufacturers do it, so I leave it. W&H is a well-known and trusted dental brand, so if they think it needs an auto test, then so be it. Okay, the first thing we do to validate that this machine is actually working according to manufacturer's specifications is once a week, we check that the machine itself can actually create a vacuum, because that's the only way in which we can create a sterile atmosphere inside our instrument packs. And so we leave the machine on its own, and it runs that test. It takes about 20 to 25 minutes. And that test needs to be done every week. So one of the things that the regulations also say is that when we move from the dirty side of the room to the clean side of the room, because the ultrasonic machine has removed a lot of the contamination from the first patient on which the instruments were used, the gloves have to be changed from the gloves that were used on the dirty side of the room to another pair of gloves that are used on the clean side of the room. We look on the screen here and we can see that the cycle is completed. The vacuum test has been completed. There's a green tick there to show that the cycle was successful, and that means that this machine is able to create a vacuum inside the pouches that are used to protect our instruments. And there's a separate test that I will show you in a second that is done every morning that actually shows that the machine itself is able to push steam at 134 degrees Celsius into our instrument packs to ensure that a sterile environment is created inside those instrument packs. Once the instruments are cleaned, we are able to sterilize our instruments in these self-sealing pouches and store them for the required amount of time, which is a year. How do we know that the instruments inside this packet are actually sterile? And we know that through what is called the helix test. And earlier on I talked about steam penetrating these pouches, and we simulate said penetration with this little device, which has a lumen, which has a tube with a lumen that is 2 millimeters in diameter, really tiny, and this tube is about 1.5 millimeters long, all curled up into this device. And then you can see inside there, so the steam is forced through that 2 millimeter lumen, down a coil, which is about 1.5 millimeters long, and forced out of that into this device. So it's blocked at one end, open at one end. So what do? We get this little test strip, which is black here, which is the reference color, and pink there. And the manufacturers have told us that when steam at 134 degrees hits that pink bit, it should go black like that. So what we then do is push this in, okay, and then lock that. And so at the end of this test, if that pink section is now black, we know that the only way it went black was through steam that has been forced into that tube down a coil of 1.5 millimeters into that green bit. And so that's the simulation of steam penetration. As I said, this is plastic on one side and paper on the other side. What this is simulating is the ability of steam to penetrate the paper, sterilize the instruments in the paper, and then the machine, through its vacuum, sucks out all the steam. And as long as the packaging remains undamaged, we know that 134 degrees Celsius of steam has gone into those packets, killed off all the bacteria and viruses, and therefore the instruments in there are sterile. So how do we do this test? Then this test is carried out every day so that we know that all the instruments on the day are sterile. We just put the simulation device into the machine like that. Close it. And so you'll remember we did the vacuum test earlier on. It's now the Helix test. We've inserted the device only. And then we let it do its thing. It takes about 30 minutes. Now the Helix test cycle has been completed. We are going to open that out. Ow. Give me a second. And take that out. And as I said earlier on, the pink bit should now be black. And as you can see, remember, that was the reference color. That's now black because steam that went in through that tube down the 1.5 millimeters of coiled tube into that hole then came and changed the color of that. And that way we can verify that the machine, at least today, is able to push steam that far and would therefore be able to push steam into this pouch, which clearly is only about a millimeter thick compared with a tube that is 1.5 millimeters long. And so we repeat that on a daily basis to ensure that we're able to verify that the machine is working in its ability to push steam into those packets and therefore sterilize the instruments before they are used in you. So now that the instruments have been inspected on the light for visible debris, we know that they're free of proteins. Now we're going to show you exactly how we make the instruments sterile. We have these pouches, different sizes for different types of instruments. We have more pouches in there. Ghislaine is just going to pick an appropriate size, essentially a self-sealing pouch. She's then going to put all the instruments into said pouch. One side is paper, the other side is clear plastic so we can see what's in the pouch. The label is going to be taken off and then pouch sealed. We then put that on one tray, goes into the machine. So what we're trying to show you is how that pouch that started from one patient with lots of contamination, was cleaned to remove debris, is now going to be sterilized for use in you. What we're going to do is pick the 134 degrees Celsius, so the machine is going to create 134 degrees Celsius inside this sterile chamber, because we know that at 134 degrees, all bacteria and viruses will be destroyed. You may be asking yourself, why does it have 121 there? That's because EU regulations allow 121, but UK are 134. So what we do is we press that again, and legally, if we put the instruments in a pouch and then go into the machine, right, we can store those instruments sterile for a year. And that's why there's that 52 weeks. And you'll see this number of labels will make sense to you in a second, but we've just put one instrument pouch in there. But if there are 20 instrument pouches, what we're just doing is change the number there depending on the number of instrument pouches in there. And then we start. And the machine locks itself. We'll show you what happens at the other end and why the screen was the way it was in a second. As you can see, the cycle is complete. There's a green tick, and for that green tick to be there, it means that all the parameters for sterilization have actually been met. So let's just open. It is piping hot, so I'll try to be very careful. Now the data is saving, and the next thing we notice is this label here. This label contains a barcode, and what we're going to do in a second is take that out, put that over here, and this is, as you can see, that's the sterile area, so we know that each individual part of this sterilization room serves a very specific purpose. So now we know that the instruments inside that pouch have been sterilized. We have this barcode that we put on there. As long as this pouch is unopened, the instruments inside this pouch will remain sterile till June 2025. The barcode is very useful because not only are we able to show how we keep our instruments clean, the information inside that barcode would then be stored in each individual patient, so that we're able to not only demonstrate that we clean our instruments generally, but we're able to demonstrate to you that the instruments that we used in you were clean and met all regulatory standards. Very few dental practices invested in this kind of technology in terms of traceability, in terms of being able to show each individual patient the instruments we used in you were actually sterile. I chose to go above what is legally required in the UK because, quite frankly, I said to all the team here that I want to make sure that everybody that comes in here either leaves as they did or leaves better. And we take your safety, essentially, we take the transmission of infection from one person to another very seriously. And I'm hoping that what we've shown you right now shows that we take great steps in ensuring that when you come into our practice, you actually leave better than you came.